I'm not shocked by the stats.
The health status of Manitobans report was released this week, and despite an overall gradual improvement in the life expectancy of people in the province, the data shows disparity in health outcomes between certain communities.
When we look at the factors that Dr. Roussen's expressing in this report, white people do better.
Dr. Barry LaValle reviewed the report and wasn't surprised by what he saw. The report, written by Manitoba's Chief Provincial Public Health Officer, Dr. Brent Roussen, shows that First Nations people in Manitoba have a 3 times higher premature mortality rate and a 4 times higher potential years of life lost compared to other groups, a gap of 10 years.
If we lose 10 20-year-olds compared to 10 80-year-olds, there's a loss of the personal loss of a human being from a family, but there's a loss for us of a lot of years of the potential to develop leaders, the potential to support development in Manitoba for all Manitobans. And so it affects all Manitobans when you actually have loss of life that's far too premature.
Dr. LaValle says he applauds the deep dive Roussen's team did on determinants affecting Indigenous peoples, saying reports just 10 years ago did not focus on this. The report also reviewed the impact of COVID-19 in Manitoba from August of 2020 to March of this year, showing a relationship between income level, race, and severe COVID-19 disease. It's this data that Dr. LaValle says shows cause and effect and a need for drastic change in the province.
For example, congenital syphilis, which is higher in our community now, related to methamphetamine use, really is the source is the trauma. The First Nations women, we all know about missing and murdered Indigenous women and girls, and the consequences. We've just had 4 young women found to be killed by a serial killer here in Winnipeg. That is a public health emergency.
Some report recommendations include setting measurable goals, including targets to reduce health gaps outlined in the report. Dr. LaValle says Manitoba Health is pulling away from Indigenous groups after successfully working together through the pandemic, and hopes this report reverses that. He also hopes this report shows the province the need for methods they may have previously avoided.
You need to get rid of your attitude that harm reduction and addictions is a really big faux pas in society. It is a problem for everybody. And if we don't take care of harm reduction needs, congenital syphilis will continue to go up. Murders will continue to go up. Okay, we need to give opportunities for people to settle down inside.
Dr. LaValle hopes to see the recommendation to support Indigenous-led health responses acted upon immediately. In Winnipeg, Mike Albanese, City News.